Hi, good morning. My name is Autumn and I will go ahead and take care of you today. We are going to go ahead and take care of your Mohs surgery today. I'm going to go ahead and bring you out to the back and we're just going to go ahead and sit down, talk a little bit about what's going to happen today, answer any questions that you may have, and then from there we'll go ahead and see if we can bring the doctor in to go ahead and start. Okay. All right. Thank you for coming back in. Hello. So we are going to go ahead and take care of your Mohs surgery today, and I just wanted to go ahead and talk to you about the lesion that you have on your cheek. Okay, I know that you've had this for a while, but this surgery is going to go ahead and we are going to put you under anesthesia, and then after that, you are going to go ahead and not be able to feel anything, be completely unconscious. And Dr. Monroe is going to go ahead and remove the lump that's in your cheek. That lump can ultimately become cancerous, and that's something that we want to avoid, especially because you did describe that you have skin cancer history in your family. So we're going to go ahead and make sure that we get that taken care of. Afterwards, you will feel a bit of pain, but we're going to go ahead and numb up that area very well to where you won't feel it for multiple hours. You'll just feel it tomorrow morning whenever you wake up. And we'll also prescribe you pain medication. But the surgery is quite invasive because it does have to do with removing the lump, but it is also one where you can go ahead and go back to work almost instantaneously. You can go back to work about 48 to 72 hours after the surgery. We typically recommend 72 hours, especially if it's your first time, and especially if you haven't had surgery for a long time. That's very important to note. But please always understand that this is something that is going to be very traumatic. And not necessarily traumatic in the sense that, you know, the surgery is going to be harsh, but rather you are going to feel, you know, that pain on your cheek for a very long time, meaning after the surgery. So I want you to be aware of that, especially because we don't want you stating that, you know, that we hurt you in any way. So just please be aware that with removing the lesion, it is something that is very, very sensitive to facial tissue. So please keep that in mind as well, okay? Did you have any questions for me? Okay, we're gonna go ahead and schedule a 2-week follow-up for you to come back. Are you able to come back on the 8th? Okay, we can bring you back on the 8th at 2:30. Does that work? We don't have any morning appointments that day, no ma'am. Okay, you can make it? No, so all that's going to be is Dr. Monroe's just going to go ahead and look at where we did the surgery. We're going to see how you're doing, see if you're experiencing any pain, making sure that the area is not infected, etc., etc. Nothing too crazy. Okay, I will go ahead and schedule you. I scheduled you for the 8th at 2:30. Did you have any questions for me? Okay, all right, sounds good. So I am going to go ahead and prep you for the surgery. I'm going to first get Dr. Monroe to come and introduce himself, and then from there, I'll go ahead and take care of you, okay? All right, thank you.